On today's Two on Your Side town hall, with more and more people eligible to get vaccines, we know a lot of you are trying to book appointments, and pharmacies are going to be a big player in that. We're going to have a guest to talk about that.
Plus, our Verify team answers a pretty simple but common question. Can you get the second dose of a vaccine in your other arm?
And among your COVID travel questions, a lot of you are asking when cruise ships will be back out at sea. An in-depth look at that will be just ahead.
We will have all of those stories, and also later on our rundown, a constitutional expert will walk us through the legal issues surrounding mandated vaccines and tests and those so-called vaccine passports. Kate.
Yeah, we're glad that you're with us on this Tuesday evening edition of the Town Hall. I'm Kate Welshofer.
And I'm Michael Wooten. In just a moment, we hope to be connected with our first guest tonight to talk about how pharmacies are going to be playing a huge role moving forward in administering vaccines.
Yeah, it could be a real game changer there, so more to come on that. And we always get a lot of questions from you. The Verify team gets to work on it, and today they've been looking into about those two-dose vaccines.
Yeah. Some people are asking, when you get one that requires two different shots, do you have to get them in the same arm? It's a simple question, but we wanted to get an answer, and here's our Evan Kozloff.
The Verify team is here to answer your questions, big and small, about the COVID-19 vaccine. So let's address this quick question. If you're taking one of the two-dose vaccines, can you switch arms? For example, take the first shot on the right and the second shot on the left? Here are our sources to answer this one. The Centers for Disease Control and Prevention and Dr. William Schaffner, an infectious diseases professor at Vanderbilt University. Both our sources say that the answer is yes.
When you get the two doses, the vaccines can be given in one arm or the other arm.
The CDC points to a specific circumstance called COVID arm. Some vaccine recipients might experience a red, itchy, swollen rash at the injection site. And in those cases, they say you can discuss getting your second shot in the other arm.
The inoculation site doesn't matter because your body's immune system will recognize that and take action and provide the protection you need.
So we can verify that when you're getting that vaccine, it's no problem to switch arms. With your Verify, I'm Evan Kozloff.
And so now you know. If you've got something for us to verify, you can drop us a line on social media or email us verify@wgrz.com.
And you can also message our text 2 line. It's 849-2200.
Well, as younger people are now eligible to be vaccinated here in New York State, remember now it's 30 and up, that age group is also the source of a troubling number of new COVID cases here and around the country.
Yeah, NBC's senior medical correspondent Dr. John Torres explains why that is concerning a lot of experts out there.
We are seeing public health mitigation strategies relaxed too soon. States are easing restrictions, and young adults are now driving this increase in infections. Now, I know we all have pandemic fatigue, but we are heading towards a fourth surge. We know these surges will prolong the pandemic, and a rise in cases will also bring more dangers, including new variants that can spread quickly and may also have an impact on how effective the vaccine is. The vaccines are working, and we are vaccinating on average 2.7 million people a day, but we've only fully vaccinated around 15% of the total population. So the bottom line is we have to hold on a bit longer with masks, social distancing, and avoiding large crowds, but the finish line is in sight.
All right, Dr. Torres, thank you. We want to get back to our top story now, and a lot of people were in front of a computer or on their phone at 8 o'clock this morning sharp trying to book vaccine appointments. We know it's challenging because demand still outpaces supply. And President Biden recently announced a big change going forward to shift even more of the focus to pharmacies.
Already 21 chains and 17,000 total pharmacies have been part of the federal program. And recently, on average, they've been able to administer around 1 million doses a day.
So the White House has decided to expand that pharmacy program, more than doubling it to 40,000 sites around the country. Within 3 weeks, there will be a vaccine site within 5 miles of 90% of Americans, and most of those will be pharmacies. Let's discuss that now with Diane Lawatsch, who joins us live. She is vice president of the Community Pharmacy Association of New York State, and also her day job, she is director of managed care and business relations for Wegmans. Really appreciate you coming on the show and talking to us about this important topic.
Well, thank you so much for having me.
And we're wondering a couple of things right off the bat. First, what is your reaction to the pharmacy program expanding? And on a day that millions more New Yorkers became eligible for the vaccine, how is the supply situation and are you getting more doses?
Yeah, so to answer your first question, we're thrilled. We're thrilled to be able to participate and help the community in this way. I think pharmacy is well positioned and always has been to provide the access that patients need to provide this service. And as far as the doses, we are seeing fluctuations, and we did receive more doses than we did the prior week. So that's great news. Right now, we're really on a week-to-week basis as far as finding out what kind of or how many doses that we receive.
Yeah, same with all the different sites, right? Counties and obviously pharmacies and doctors' offices. Yeah, you're playing that waiting game a little bit. If pharmacies are going to be relied on so much going forward, as we're now being told, I wonder what the planning is like. Is it just that more pharmacies are going to be involved, 40,000 instead of 17,000? Or do you think that, current pharmacies that have been administering doses, are they going to be able to maybe scale up and administer even more?
Yeah, I think more to your second point, I think pharmacies are really going to be scaling up. There will obviously be more locations, which is incredible, but I do think that probably most retailers are not at capacity, at least at Wegmans. We're not at capacity. We're able to take on more doses and look forward to doing that in the community.
Certainly we know that there's a lot more people who are trying to get shots now. Do you have advice for our viewers watching right now who have been trying to get an appointment? A lot of them would probably love to get the vaccine at the pharmacy that's right by their house. What do you tell people, including people who maybe are not that tech savvy or have trouble navigating the online scheduling?
Yeah, that's a great question. I think we do see that, and that's why at Wegmans, we've provided a phone number so folks who aren't tech savvy or don't have access to a computer, they have the ability to still make an appointment when our vaccines are opened up for appointments. We're still, again, waiting each week to find out how many doses we receive, and then once we know that, that's when we set up our appointments. We really want to wait until we have shots in hand before we will set up those appointments so that there's no scheduling snafus. But I think, for those who need appointments, they can still call typically the pharmacy and find out how to do that. I think now that we're seeing some additional vaccine come into the marketplace, especially into pharmacies, we'll start to see that free up a little bit.
Yeah, and that's definitely good news. And you're right. I mean, the last thing you want to do is somebody makes an appointment, they get excited, I'm finally going to get the vaccine, and then, you have to tell them we don't have it for you. So that there is an understanding to that delay. Finally, and I feel like we never talk about this, and so I thought today was maybe a good opportunity because it is so real life. Can you just walk us through what happens when somebody who is lucky enough actually gets an appointment, they have a time, they walk into a Wegmans or somewhere else? What is the process like, and what can people expect when they go through that?
Yeah, they probably can expect that it will take roughly, 20 minutes to a half hour. So they have several pieces of paperwork that they have to fill out, from an informed consent to an attestation, depending on if they fit the right demographic to receive that vaccine. Oftentimes, after we then provide the vaccine, there's a 15 to 30 minute observation period. So it does take a little bit of time, and that's all for the safety of the patient. But by and large, we really have the process refined at this point, and it's pretty painless for the most part for patients to get their vaccine.
All great information. Diane Lawatsch is Vice President of the Community Pharmacy Association of New York State and also an executive with Wegmans as well. Diane, thanks again for all your perspective tonight.
Yeah, of course. Thank you for having me.
Thank you very much. And coming up on our town hall on this Tuesday, just about everything in the U.S. has reopened to some capacity, but not cruises. We have an update on when these ships may be back out to sea next.
You are watching our daily town hall here at 5:30. We'll be right back.